Hello and welcome to the YouTube channel of Pearl Women's Hospital and Yash IVF. I am Dr. Chaitanya Ganpule, Managing Director of the hospital. Today we are going to discuss something which is very commonly asked or comes in the mind of the couple who comes for an IVF treatment. The very common question that is asked to us by a couple is, what is the cost of the IVF cycle? Today let's discuss whether it's important for us to discuss about the cost of IVF cycle, or whether we should be reframing the question and asking about what should be the cost to pregnancy. In my opinion, the focus should be on the cost to pregnancy rather than cost of the IVF cycle. But to know this, first of all, we should know what do I mean by cost of an IVF cycle and what do I mean by cost to pregnancy. Well, when I say cost to an IVF cycle, it includes the hospital cost, the medicine cost, the laboratory cost to prepare the embryos and then transferring that embryo back into your womb. So this usually starts with the stimulation of the female partner to develop the eggs and then ends at the embryo transfer, which is usually a fresh embryo transfer. As against that, if you consider what is the cost to pregnancy, it is the total cost which you have to spend from your pocket to achieve conception and sail through the pregnancy, which ultimately culminates into a live birth. Now, when I say this, you may get pregnancy in the first cycle or in one cycle, or you may have to do repeated cycles. So when it comes to cost to pregnancy, all those cycles which you have done put together is what I say cost to pregnancy. So rather than concentrating on cost of an IVF cycle, one should concentrate on the cost to pregnancy. Now, when it comes to cost to pregnancy, obviously it will depend upon the success rate of a particular center. So if the success rate changes, obviously the number of cycles which are needed to conceive or achieve pregnancy changes, and that's how your cost to pregnancy changes. So are there any factors which can tell me what the cost to pregnancy could be or what a success rate depends upon? Yes, there are definitely certain factors which we have to consider when it comes to a success rate. So the success rate depends upon the medicines which you are using for stimulation, whether you are doing an IVF procedure or whether you are doing an ICSI or intracytoplasmic sperm injection procedure. It also depends upon whether you are doing a day 3 embryo transfer or whether you are doing a day 5 embryo transfer, and then whether you are doing a fresh embryo transfer or whether you are doing a frozen embryo transfer. All these factors will dictate the success rate, and that is going to dictate cost to pregnancy. I am going to discuss on each of these factors in my subsequent videos. So do keep logged in or do keep visiting our YouTube channel for the next video. Up here today, if you feel that the information that I have just shared with you is going to help someone of you or your relatives or friends, please do like, share and subscribe to our YouTube channel of Pearl Women's Hospital and Yash IVF.